everyone. Thank you all for joining. A special thank you to our speakers. I am Zakria Abdalmomen, and I'll be moderating the discussion today. If you think of any questions for our panel, please post them in the comments section of our Facebook Live broadcast, or if you are with us on Zoom, please post the questions in the chat function. Once I start addressing the questions from the audience at the end of the event, and you pose a new question, it is unlikely that I will address it. So please pose it before I start addressing the questions. Thank you, the audience, for joining us today. Please keep your cameras and microphones switched off, or you might show up on our Facebook Live broadcast. I urge you all to please be respectful towards our speakers, staff, and other audience members. For our topic today, we will be discussing the psychology arena and mental health in terms of our current smaller world. This discussion will highlight the recent impacts on mental health, its care and awareness, and how it exists in complex layers of issues that differ around the world. Many of us have been forced to live in our daily lives online, which can be illustrated purely by the fact we are organizing this on Zoom. This, in many ways, made us more internationally connected, resulting in the current smaller world. This, of course, has its pros, but also severe cons, even if we do not mention the pandemic itself, which of course we will. There has been rampant mis and disinformation, mental health struggles of our medical professionals, mental health professionals finding it more challenging to reach their clients through efficient means and much more, which we will of course get into today. We will conduct this event with the hope that we spread words of friendship and diplomacy, regardless of whether we agree or disagree with one another. In this small world, many of us have gone into survival mode. In this discussion, we hope to send a message of hope to live and not just survive, focusing on personal positivity with planning and strategies. Thank you all for joining us today, and with no further delay, let us begin by introducing our speakers. First, we have with us Dr. Adrian Lowe, a chartered psychologist from Hong Kong. Dr. Lowe's workplace stress research has won presidential awards for doctoral research excellence at the California Southern University in the United States. He is the president of the Hong Kong Association of Psychology. He is also an adjunct faculty member at the University of Worcester in the UK, as well as an adjunct lecturer at the University of Hong Kong. We have also with us Kudawashe Mushonga. Thank you for joining us. He is the program manager at the Zimbabwe United Nations Association, working closely with people in Zimbabwe for the United Nations in Zimbabwe. We have also with us Dave Sleet, managing director of one of our partner organizations, the APA, which he will speak more about with us today. He is an international presenter, speaker, and published author. David specializes in cognitive behavioral therapy. Unfortunately, the CEO of APA couldn't join us today, Bonnie Crosby. She is also an international presenter, speaker, and published author. Bonnie is a qualified mediator, family therapist, and supervisor. We have also with us Dr. Abdirizak Yusuf Ahmed. Thank you for joining us. He's the Director General of Di Martino Hospital, public hospital in Mogadishu, Somalia. He's also the National Incident Manager for COVID-19 at the Ministry of Health and Human Services of the Federal Government of Somalia. Dr. Ahmed is a leader in the fight against COVID-19 in Somalia. We have also with us Harsimran Kaur Wadhwa, sorry for absolutely butchering that pronunciation. She is a trained medical health counselor, certified nationally in the United States. She works at the Hispanic Community Counseling. She's also currently a doctoral candidate for Doctor of Psychology at the Immaculata University in Pennsylvania, United States. We have also with us Dr. Prabhjeet Singh coming, Narula, connecting to us India. He's a psychologist who practices in Delhi, India, and has 6 years of experience in the psychology field. He's the director of his own practice. It's called Psy Science. He specializes in many things, including family counseling, marriage counseling, psychotherapy for adults, obsessive compulsive disorder treatment, among other things. Narul is currently an advisor for the Peaceful Mind Foundation. Thank you for working with us at the PMF. We have also with us who would hopefully join in a few moments, Honorable Hosna Jalil, who's the former Deputy Minister of Interior of Afghanistan and the first woman to have appointed that position in 2018. She used to be one of the highest female officials in Afghanistan. She has been a strong advocate for women's rights and strong policing in Afghanistan. She was also later on the Minister of Women Affairs. Hopefully she could join us in a few moments. So that is all of us right now. Let us start with you, Dr. Adrian Lowe. We're gonna go by question by question for each of the speakers. Hopefully I'll be able to keep track of the chat function. Tanvi, of course, from the PMF will also help me keep track of the Facebook live broadcast comment section. Now, Dr. Adrian Lowe, thank you for being with us today. As an academic in the psychology arena, what do you think should be added to the global psychology agenda, and what strategies do you think would be useful in 2022?
Hello, everyone. This is Dr. Adrian Lowe speaking. I'm the president of Hong Kong Association of Psychology. If we were able to turn the clock backwards, I'm sure we don't have to realize that we don't need the COVID or pandemic to remind us that psychological hygiene is just as important as washing our hands. Because for pandemic, I think has been generalized that most people would see mental illness as shaming, stigmatizing, and wrong, right? So in a way, I think we can be also thankful to COVID, the pandemic, because without the psychological hygiene, okay, we don't really have true health, isn't it? Now, when we look at the data, and I'm actually looking at data right now from this website from statista.com. I'll share this link with you guys if you guys are interested. And it's saying that in the US, since April 2021, in April 2021, about over 200,000. Repeat that. 26,174 health workers has been being interviewed, and over 46.6% of the health workers in the US, they actually work over 60 hours or more per week, and they're actually reported having depression. And what's worse is 11% of this group starts to have suicidal ideation. And I think the main point over here is that the more hours that's being put into serving the community in terms of the health aspects, the greater the depression and the greater the suicidal ideation, right? And if we also ask the rest of the population, that 45% of Americans say that the coronavirus pandemic is impacting their mental health. And 34% of the Americans are looking for anti-anxiety during the pandemic. And that's like a 19% increase of the reliance of antidepressant during the pandemic. And there's definitely and obviously a sharp rise in the calls to suicidal hotlines. And you can see healthcare workers themselves are being traumatized, right? So even healthcare workers are traumatized. What more about the general public, isn't it? So I think the point I want to make over here is that with the pandemic that's happening right now and has been ongoing for over 2 years, right? way more serious than expected. And I want to also share the Hong Kong situation with you guys as well. And I just want to make the long story short because we have so many speakers and I just want to make sure everyone have enough time to share. You know, in Hong Kong, before the pandemic, the government in Hong Kong has planned to tackle the dementia situation, whereby they have predicted in 2040, 1/3 of the populations in Hong Kong, such as the elderly, you know, 1/3 of them will be the elderly and 1/3 of them will have to deal with dementia. And seems like this agenda will have to be carried forward because due to the pandemic, because the pandemic, the agenda or pushes the early onset of the dementia. And also in Hong Kong, and I think this could be a global mirror as well, that is to be the primary treatment for psychotic patients in Hong Kong. And there is a lack of alternative treatments available. I think it's all about communication issues as well, because the side effects of medications were not patients, and patients are not informed about alternative treatments besides psychopharmacological treatments. And research have shown that dementia can be caused by many factors. It can be caused by certain, especially antidepressants, the meds that trigger the earlier onset of related symptoms. And now back to the larger picture. Now of the pandemic and a surge in PTSD, post-traumatic stress disorder. And we can also see PTSD will cause or trigger an early onset of dementia symptoms as well. So therefore, we can see that dementia is definitely a big, we have to tackle it with urgency. And in fact, I mean, put it humorously, you know, we're actually pushing people, you know, towards exhibiting dementia symptoms way earlier. I think we need to, you know, seriously put mental health education into the policies, into our educational systems as well. So, and we definitely don't need to have the pandemic to remind us to put mental health education.
Dr. Low.
2022. And I also want to add that from the psychological aspects, I mean, or let me put it, in order to define what is a healthy person, we need to have in place 4 healthy circles. And the first one is biological, second one is psychological, and the third one is the social, and the 4th is spiritual. So I think as we, or other speakers, as we start to, you know, plan policies and educational reforms, we have to think about preventive strategies in terms of these 4 circles. So biological circle, we are talking about not just washing our hands frequently, you know, or taking vaccines, because it's just part of the answer. It also means we have to eat right, we have to exercise, we have to get adequate sleep, and shoring up our immune systems with maybe vitamin D's or C and zinc, right? And in the psychological circle, we need to practice mental hygiene by disinfecting our negative thoughts, because our head may be filled with, you know, I like to coin this term ants, you know, ants. When we see ants in our home, we definitely want to, you know, destroy them, right? But we have ants in our mind as well. Ant stands for automatic negative thoughts. So therefore, I think educational reform have to consider, you know, our next generations to educate them, you know, to think properly, to disinfect the mind with the negative thinking, so that whenever one feel anxious, angry, stressed, we will be able to, you know, overcome it, you know, in a naturally and psychologically as well. Now, the third one, be really fast in this, social circle. We need to know what we want out of life, and whether our behavior, you know, is helping us or hurting us. And it's also important to connect with people, or safety. so that the other people in the social circle can help the individual to best develop the best version of oneself. And finally, we have the spiritual circle. And spiritual circle, we're not just talking about the religious aspects, but we're talking about, or we're considering about why each and every one of us are on this planet. I'm sure all of us here are valuable. We have our own identity, right? And we have to think about how we give back into the community. So therefore, the main message I want to make is that we definitely have to seriously put psychological health into education, into the policies, and we not just combat the pandemic, but we also have to put in the preventive strategies as well as curative strategies for our psychological well-being. For this, thank you very much for your time, and I'll pass back to Zakria.
Thank you so much, Dr. Adrian. Well, it is also really important for us to try to clear our minds and connect with people during these troubling times. And you're absolutely right about it differing from country to country. And thank you for sharing the experience and more information specific to Hong Kong. Thank you so much for that. Now we shall move on to Kudawashe Mushonga. Someone joining us. All right, thank you for joining us today for our end of year event. I hope all is well in Zimbabwe, and happy holidays. Now, for our viewers, if you could give us an overview of the struggles in Zimbabwe and what Zimbabwean citizens have experienced in 2021, from which you have witnessed working for the United Nations Association. And in your role in the United Nations Association, some of your goals that you would like to accomplish within the next year. I think the viewers will be very interested in hearing more about situations specific to Zimbabwe and that region in Africa.
Okay, thank you, Zakria. Yes, my name is Kudawashe Mushonga, and I'm the programs manager, as already noted, for Zimbabwe United Nations Association. We mainly work with the youth in the grassroots and grassroots groups. And mainly 2021, as generally noted across the globe, has presented its own fair share of challenges, in my country specific, whereby, the increase of lockdown, and then you have how it has forced people to kind of switch from certain economic activities that might have helped them in the past, have been greatly been constricted in the new environment, whereby forcing people to think of other means or other alternatives of acquiring funds to, for day-to-day use, or just in general for the upkeep of their families. So this has been quite a challenge. And I'm pretty sure that's not just specific to Zimbabwe alone, but these are some of the more general examples that have been affecting different countries across the globe. Another point, of course, has just been the general, the scare of what COVID-19 is, because, it's real and it's out there and people are dying. And, it just reaches that point in time whereby, every day you see the death count, keeps on getting higher and higher. And, the government keeps on telling you to mask up and, take precautions. Getting vaccinated has been another thing that has been, but just that ambience, that environment that people are living in is quite, stressful towards mental health. And then I can't, go on without really talking about the main group or the main stakeholder in our activities, which is the youth. And just taking a page out of Dr. Lowe's presentation, which says, before this, if we rewind to post-COVID-19, there was already quite a lot of impact on the mental health of youth, whereby I'd focus more on the social media aspect and how really it looks at the increase in expectations that has been accosting the youth, whereby when you have people constantly sharing about how great their lives are and all of that, you have this kind of like level that you want to attain. And if you don't attain it, you feel like you've not really amounted to much. And then before that, you also have expectations, family expectations. And now we're coming from the educational field, whereby your family or your parents have, paid your school fees, paid your university tuition, and they're expecting you to get good grades. And you feel like if you have not achieved these good grades, you failed them. And this is quite impactful on mental health for the youth. And then we fast forward that to 2021, whereby you now have COVID-19, and now you're being forced to study from home. And in the case of Zimbabwe, you have certain families whereby don't even have access to internet, to internet. And this is a very big challenge for someone who's studying in such an environment. And how are they going to be able to access the lessons that their teachers, is handling, is taking care of? So the youth again are being affected the most, because now you've got the expectations that are coming from your parents, the expectations that are coming from your teachers, the expectations that are coming from your friends and colleagues, your peers. As you see them progressing in life, you're being hampered by this aspect of, what am I going to do now? Because you can't exactly reverse the situation because it's in a lockdown and it's quite difficult. Your parents are trying, but they might not be able to afford a basic bundle to access internet. And this affects the child, and also exerting pressure on the parents again, that looking at child, because I believe every parent's dream is for their child to achieve a higher level than they were able to achieve. And now they're facing a situation whereby their kids, and all they can do is provide food and a shelter for their kids, and not be able to provide something, a better education, because they can't access internet services. So all of that culminating to the fact that was exerting on the stress that families were facing, different groups were facing. And now for basic activities that were taking place, I was lucky enough to be part of a group that was working on the mental health policy of our country. And this was a wonderful initiative that was being spearheaded by our Ministry of Health, and WHO and UNDP was also involved, amongst other various actors. And this really, brought up the issue of mental health, and really people got interested, because now we had government officials, you had everyone, you had civil society organizations, you had schools, because the outcry had become so much, and that there was a need for upgrading the mental health policy and getting more information about mental health, because you'd see that there were some gaps that were identified in the terms of the trainings of certain practitioners, mental health practitioners, big psychologists, be the doctors themselves, onto the different, should we say, conditions that might bring about mental health, or trying to assess mental health in patients. So all of that was culminating into this policy, and this group have been working, on upgrading the policy, and it's been coming along quite efficiently. And we're reaching that point in time whereby it's ready to be, issued out, people to get to that point whereby it's going to be discussed in Parliament. And this has been a major initiative, and it's quite thankful to the Zimbabwean citizenry that mental health, alongside other issues such as gender concerns, has been noted and been said that no, this is a critical issue that is affecting the citizenry, and how best can we get people to access such services, especially in terms of a lockdown, especially in terms of the COVID-19 era, and what would be the best way forward for the citizenry, for the people, for the grassroots, to increase their knowledge, to be able to, to share amongst themselves, to be able to try and, because it all starts from the family unit, then it extends from there. How can we best tackle this issue from the family unit, progressing all the way eventually to the national level? So those were just some of the issues and some of the reactions, and some of the policies, some of the strategies that have been happening in my country. And what, as an organization in 2021, with our work with the youth, we have really have made kind of like, again, maybe now focusing on the benefits of social media. And we've created social media groups whereby, not saying that they were very efficient social media platforms like the Youth Bench, which is quite effective in helping the youth. And that was one way whereby we told the youth that if they have any issues with what might be with what might be happening, they can, come through on the youth bench, share whatever it is that might be affecting them, not on the bench specific, but inbox. I'm one of the people which they can inbox, and helping the youth, just try and get over that factor that you're not in this alone. Like it was mentioned, that some people take that mental health is kind of like an embarrassing thing, whereby nobody else is experiencing this, or how do I even come up to my parents and even bring it up to them and say, I'm suffering from this, I'm suffering from depression? Because again, from a cultural perspective, the male half of, should I say, the male population from a cultural perspective is not allowed to, to show emotion in times of distress. Like, that's how we're raised. Men don't cry, that kind of thing. And, we're trying to combat that philosophy that bottling in emotions is not a good thing. You need to be able to discuss it. You need to have people to go to, people who are going to understand what it is that you're bringing towards them and how to tackle it from a cultural perspective. That's how we need to debunk some of these myths. And that's what we've been working on. And that's going to be part of the goals for 2021, whereby we're going to be trying to debunk some of these myths in the mental health sphere, and also assisting the youth as we've always done. And hopefully we'll have more information and more positivity, and also more goals achieved by the end of 2022. So yes, thank you.
Well, I could say that we all really hope that you reach those goals at the end of 2022. And I think that we have a lot, that the world has a lot to learn from that strategy of having a unified policy from different entities, reaching out and communicating, including through social media, to reach out to people, to get different sides of policy, including gender policy. So I think we all have something to learn from that strategy, and working with youth, that's also another layer of the complex situation that we have in these troubling times. So thank you for including that. That is really important perspective. So thank you for joining us and including your strategies and your experiences into this discussion. Now, Mr. Dave Sleet, I would like to move to you. Now, Dave, you have a lot of experience in the psychology field as a speaker, as an advocate, and as somebody who works with people on a one-to-one level. Mm-hmm. Now, since Bonnie is not here and you're alone here representing the APA, I sort of have a double whammy question for you.
I thought that was how it was going to go.
So as I've said, many in this world, many people, including many people in this meeting, have really got into survival mode in the last couple of years, not just in 2021. Mm-hmm. And we previously discussed this in previous meetings as well. As a psychologist, with experience with clients, what do you think people could do to get out of that survival mode, to focus more on their personal mental health and positivity? And if you could give us sort of an explanation of the APA framework you guys have.
Okay, so I'll come to the framework second. First off, I think everything that's been said points to where the solution lies. And that's a realization that mental health is not something that happens to us, it's something that is in us. It's constant. It's just like our physical health, just like our heartbeat, it's constant. And when we can absorb that, when we can accept and act based on that sliding scale that is impacted by what happens to us from the world around us, we're able to address mental health in a very different way. The second part of that has already been mentioned, is understanding stigma. And stigma is something that when we remember where stigma came from, what does stigma mean and how did it come into existence? To stigmatize something is to claim ownership of it. That is what's to stigmatize something was originally about. And it was about human property. It was how somebody in power marked somebody else so that the world knew that they owned that person as property. That's what stigma is. So when we are being stigmatized by somebody else, we need to kind of think about what it is that they're actually saying. Because it's not about the person that's being stigmatized, it's the person doing the stigmatizing who is saying, whatever it is that you are dealing with, I can't cope with. I don't like it. I don't know what to do with it, so go away. And in order to do that, we create that stigmatization. So the embarrassment of stigma should never be with the person being stigmatized, because they're living and managing the situation that is in their life. The embarrassment, the fear, should be with the person who is saying, I couldn't deal with that. Whatever it is that you've got going on, I don't understand it, I don't know, you need to get away from me. Because that's their weakness, not yours. Step one. Something else that's already come up is about policies and education. And this will link into the framework that app has created. But BC, before COVID, our mental health systems around the world were a plug-in to an infrastructural system that was not designed or aware of how mental health actually works. And I don't think anybody in this meeting would disagree with that. But when you plug something into a system that it was not designed for, it's a bit like trying to put a floppy disk into a USB drive. It's not going to work. And that's what mental health was doing before the pandemic. The pandemic has been an amplifier. And as Zach mentioned earlier, it's a way of looking at what the opportunities are. We've seen good rise to the top, and we've seen bad plummet to the bottom, and we've seen indifference spread across the middle. And that's human nature. When we are under pressure, the good will rise, the bad will fall, and what is in the middle just stagnates. Getting past that, getting out of that mode, requires everybody to have a greater self-awareness. So how do we get past it? Let's not use the tactics that we had BC. BC, we would tell people, if you're having a mental health issue, you need to go and talk to somebody. When, as has already been pointed out, for a large part of our population, the idea of going to talk to somebody has already been kicked out of them through life. So why are you going to go and talk to somebody? You've been belittled at every emotional expression that you've had as a child. Big boys don't cry. That was a phrase that was mentioned moments ago. When we do that, we tell a child, your emotional need, I haven't got time for. So it gets suppressed, it gets bottled up, it gets turned into anger. And as that grows, it becomes a bit like a time bomb, and it will erupt. We have to change that narrative. And as mental health professionals, we should be inviting people to come and be listened to, not come and talk. Because when people are listened to, they will open up. That's human nature at its core. So the APA framework that ties all of this together is something that touches policy in 5 key governmental areas: education, children's social care, youth engagement, justice, and emotional well-being. And when those 5 areas are platformed in such a way that mental health is at the core of those policies, rather than an add-on, all of a sudden, people's engagement with those remits becomes a lot more stable. It becomes supportive, and it becomes person-centered, and we become more flexible. And this is where the need for that move from survival to thriving is the key factor, because we have given our young people a time frame of which they must learn. How many people in this room have learned more since they left school than they did when they were at school? Life is a learning process. We do not have a time frame that says, I stop learning when I leave school, when I've taken my exams. How many people have had to go back to an education environment long after leaving school? The vast majority. So we have to understand that this pseudo time frame that has been designed for a system that is no longer valid cannot be used to imply that thriving mode, because it just won't work. Moving forward into 2022, we have an opportunity, a blank piece of paper that we can take what works and move it into that blank piece of paper. The things that don't work, we can leave behind. And we can see the gaps that then need to be filled, and we can build systems that are fit for purpose. And that's what APA has always been designed to work to. Giving people the opportunity to fill those gaps and make sure that what they do is fit for purpose for them, for their family, for their community, for their nation. And when we work that way, from the inside out, and for those that understand the phrase, the internal locus of evaluation, we start to grow better and we start to grow more balanced.
Thank you so much for including multiple layers that we want to discuss today. You definitely fulfilled that double whammy I served to you. So thank you for that. So you went from youth engagement to justice to emotional well-being. Those are some of the layers that I've mentioned earlier. So thank you for going through that. And yeah, I think that really does relate to a lot of people and their struggles through the last year on a very personal level. So thank you so much for that, Dave Sleet. Thank you for joining us today. It's always a pleasure to have you in an event.
It's a pleasure to be here. And as it is end of year and the holiday season, however anybody is celebrating being able to come together, I hope you all have a safe and enjoyable holiday season, and every best wish for a safe and happy new year.
Thank you. Now, let's go to Dr. Abdirizak Yusuf Ahmed. Thank you for joining us, Doctor. Can you hear us?
Yes, hello, I'm hearing you.
Thank you for joining us. Now, we cannot really host an end-of-year event in 2021 without really getting into issues related to the COVID-19 pandemic. In Somalia, Dr. Ahmed has been fighting on the front lines against the pandemic. Through your experiences on the front lines in Somalia, how has the fight affected both the patients and the staff? I know Dr. Lowe has shared his experiences in Hong Kong. How have the patients and staff been coping in Somalia? For our audience, could you please give us an overview of the struggles related to mental health and how hospitals in Somalia have been coping?
Thank you so much, and thank you for all the panel members. It's a very good opportunity for me to be here with you and to present the situation of mental health in Somalia, in my country, and in my experience of mental health. First of all, I am not a specialist in mental health. I am a specialist in infectious disease and health system specialist, public health. Actually, for the last 10 years, I was the driving seat of the Minister of Health, was Director of Medical Services, Deputy Director General, and now for the last 2 years, I am Director of the largest one, the hospital that dealing with COVID-19, the Martino Hospital, and leading the emergency team national-wise who fighting COVID-19. But I have an interest on mental health and psychological issues. And we did some researches, although they are very preliminary in my country in mental health. So before I answer your question, let me go back to our status as a Somali people, where we are in mental health. You know, Somalia is believed that to have one of the highest in the world, major contributing, because we have a major contributing factors. We have civil conflict, more than 30 years. We have trauma, poverty, high employed, domestic violence, substance abuse, as well as also child and sexual abuse. The mental illness in Somalia is also highly stigmatizing for both the individuals and the whole family. People with mental disorders are highly discriminated against and marginalized, putting them, to disadvantage in every aspect of their life, including financial situation, housing, marriage, and basic human rights. And unfortunately, we don't have a relevant data on prevalence of mental health issues in Somalia because the long absence of the government, long absence of strategies and policies, and also the long absence of real interventions on mental health issues. Now we developed a mental health policy with the support of WHO, and that health policy also have developed a mental health strategy aligns with Somali health sector strategies, prioritizing the mental health with goals that the main goal is that have to reduce the stress, disability, exclusion, morbidity, and mortality associated with mental health problems, and also to enhance the understanding of mental health in Somalia. And one final goal was to strengthen leadership in the mental health sectors in national wise. And now we have also a private sector involved in mental health, like Habib Foundation, who have doing a great role on mental health prevention, mental health treatment, and also mental health support in the country. And they are doing a very great job in Somalia. And they were the one who was doing such service on mental health while the absence of the country. So coming back into your question on COVID-19, COVID-19 affected the health workers, the people of Somalia, because we were facing so many challenging issues in COVID-19. The people, we were facing the loss of our beloved people. Most of the healthcare workers, they lost their beloved people. We lost our fathers, our brothers, our sisters. And there was also, the protective equipment, personal protective equipment. There was a scarcity and shortages of PPEs. And there was also morbidity and mortality associated with COVID-19. There was also fear of bringing the virus home to the family members. So these factors caused the mental health issues to the healthcare workers, especially. And we did a study. Personally, I was carried that study was the title of Perceived Stress, Anxiety, and Depression, that we were focusing the stress, anxiety, and depression among the healthcare workers in Somalia. And we found that the anxiety was the highest, and also depression and you know, and then the stress. There was a highly that 3 diseases among the healthcare workers, and due to those factors. And unfortunately, there was no plan and there was no intervention elements that will tackle the mental health issues due to COVID-19 pandemics. And also the COVID-19 hit Somalia while we were in very fragile situation, while our health systems was collapsed, and while there is no health cadres that we can have the scope to tackle these pandemics. The hospitals, there was a fear on opening the hospitals, and also there was a decline on the routine health services in the country. Those also contributed, that what we expecting the high level of COVID-19. Now we included our new strategy on COVID-19 pandemics, some elements that will deal with mental health issues, especially those in frontline lines. We will do baseline assessment to the healthcare workers where they are in the mental health, and also to say if you are not okay, it's okay also. And to have the slogan of talking about mental health is a very good, because mental health is important in every stage of life, from childhood to adolescent, and also to tell the people that in the course of our life we are going to experience mental health problems. It is because of our thinking, mood, behaviors, and also there's so many factors that contribute in our mental health problems. So it's not shame that to talk about it, to discuss about it, and also because mental health problems are common, and we have to also realize the help is available. People with mental health problems can get better and even can recover from it completely. And also we highlighted in our COVID-19 strategies to have some early warning signs and on mental health issues, and also to promote the well-being of mental well-being to the healthcare workforces, and also to have some strategies that help the frontline workers to cope with the stress of life, and give them relief in the work. Make sure that they use BBEs, make sure that they get their emotional needs, and so on. And also to have a positive mental health intervention is that the people, they get professional help if they need it, to connect with people and to stay positive, and to be physically active, and to encourage helping each other, and also to encourage enough sleep, and to also encourage to get skills on mental health issues. And we hope to carry another studies. Now we did only anxiety, stress, and depression, and also we want also to expand our research to include the other mental health issues, targeting first the healthcare workers in COVID-19. And that's my intervention. Thank you so much.
Thank you so much, Dr. Ahmed, for your input. I think there's a common theme here, especially on outreach to the public and support for the public, especially for youth. So thank you so much, Dr. for giving us your input and the unique situation in Somalia. I really do pray for the people in Somalia, and I wish you and the country only but the best.
Thank you so much. And I wish all of you and the audience a happy new year, and enjoy your life. Thank you so much.
Thank you so much for joining us, Dr. Ahmed. Now, Dr. Singh has asked to jump in quickly as he has a client appointment coming up. So Dr. Singh, now I want to ask a question particularly to get an international grasp on the situation particularly in India, because it is quite unique in itself. India has been hit particularly hard by COVID-19 compared to most countries in the world, due to many reasons. As a mental health professional in India, and a mental health NGO leader also in India, from what you have witnessed in the last couple of years, not only in 2021, how has the pandemic been a burden on mental health in India, and what has been your strategy and the strategy of other professionals in India on handling that?
Okay. Firstly, it's been a pleasure, being with all the speakers. Okay, talking about India, quoting the same website that Dr. Lowe has quoted, and it says that in 2017 alone, every 7th Indian was affected by some form of mental health disorder. So we can very well imagine how the scenario would be, in 2021 or maybe coming in 2022. So I guess that would be around every 4th or 5th Indian. And a survey conducted in 2019 alone concluded that 70% of the youth have agreed that they suffer from more of mental health issues than they have suffered before. And during my practice, or you can say 2019, I was a visiting consultant, just before till 2020, just before the pandemic happened. I was a visiting consultant in one of the colleges here. And I remember that, whenever I used to visit, and in a month, I could say there used to be around 20 at least students in a month who had some issues or the other. And luckily that college was my alma mater. So I used to imagine that, when we used to be in the same college, we never had such facilities, and maybe we never required such facilities. However, when I was there in 2019, I was very surprised and shocked that, maybe you can say every other student studying there was having some issue or the other. So that was really shocking. And another survey conducted in 2020 alone, where people responded that around 45% of people responded that they have been feeling depressed or hopeless due to COVID. And out of those, 5% felt that this feeling is daily. And even in my practice, if I say, there has been a great rise in people experiencing such issues. Specifically after COVID, there has been great rise in the younger generation. I have more of college students or the young pass outs, because maybe they are more fearful about their future. Also, maybe because they were not used to sit at home for so long, and they were missing out on their life. But specifically, I had a case wherein one of the college student, maybe what happened, due to what conditions, she was more towards the depressive side. So much so that she tried to be a homicide for the whole family. And luckily she was saved. And then, she was consulting me for some time. And now finally she's quite well enough and she's back to her college. And currently I'm also, the client that is going to visit me right now is also a young guy, facing a lot of issues, confusion about the future. And, I conducted a psychometric test and I found that he is more towards the severe anxiety and towards severe depression as well. So all this is happening a lot specifically about after the pandemic. I believe because, we as a humans are social animals and we are not used to sit at home. So when the interaction is cut, we don't know who to go and approach and talk to, because we generally are not much open to our parents as much as we are open to our friends. So that friends have gone and we don't know who to speak our heart out. As a strategy, I would say, what used to be in the colleges and in the schools, the government what has made the mandatory thing to appoint a student counselor or a psychologist should continue even for the online classes that we're having, because that actually helps. because I am still visiting consultant in one more college, which is conducting online classes, and they keep my session, one of the session in 2 sessions in a month, and that is again online. And there also I get a lot of students having a lot of issues, and majorly what I find is because of sitting at home. So I believe this is what needs to be done. We need to spread the word more that yes, we mental health professionals are there for everybody. We are approachable very easily. You just have to pick up your phone or just move into our space, and we are here to listen to you. From the colleges or the school centers, again I would say this should be done, that the students also should get the access. And when I'm speaking all this, I'm giving all this data. I think this is what justifies our topic of discussion today, that mental health in a small world. Because if we compare to what the other speakers have spoken, the issues are more or less same. So that is why we can say that it's a small world where people are suffering from all similar issues because of similar environment. So as the mental health professionals here also, we can also make something or collaborate in a way so that the world can benefit. Thank you.
Absolutely. Collaboration is absolutely essential. And you're absolutely right in saying that humans are social animals. There are many people who have struggled to communicate even before the pandemic, let alone trying to do it during. So thank you for that unique perspective within schools in India, and how people really struggled, and for your for your strategies on trying to connect with the students and with clients. Thank you so much for joining us, Dr. Singh. I don't want to take any more of your time. I know that you're quite busy with clients.
Just one point. I have posted it on my LinkedIn as well a few days back, that I am open. My inbox is always open to anybody who needs help. So they can anytime message me on LinkedIn, and I will definitely try to revert back on any issue you have. So here also I am saying the same thing to the audience. If you have any issues, if you feel hesitant to approach anybody, you can always drop me a message. I'll be there. And for specific question and answers, I would request Zach and Tanvi to note it down and forward it to me. I will definitely revert back. Thank you so much. Happy New Year, everyone. And I would like to take your leave because I have a client right now, so I have to go.
Sure, I'll post your LinkedIn in the chat function. Thank you, Dr. Singh.
Thank you.
Now, we went through a lot of layers in terms of psychology and mental health. We went from supporting youth to stigmas, to outreach, to education, to reaching out to clients through online teaching. We went through a lot of different layers and struggles, including lack of resources in some areas, and lack of outreach, as well as the importance of having a unified policy and collaboration to solve these issues. Now, I think it's really important, beyond important, that we also reach people on a community level. Now, Harsimran, I know that you have quite a lot of experience with communities, with reaching out to people on that very personal level. I would like to very much learn more about that, how it's really worked, especially when switching back and forth from online to in person, how it made it more difficult, or what kind of challenges you faced to reach those communities throughout the last year, and what you hope will come out from community outreach within the next year. Thank you so much for joining us.
Hello, thank you for having me, first of all. And hello, audience. Thank you for joining in from various countries. This is so nice to see you all. And thank you, speakers, for giving your amazing point of views. So my name is Harsimran, just introducing myself. My name is Harsimran, and hi from the United States. That's a really good question. I think all like mental health professionals are questioning all of this. Like, is online better? Is in-person better? Is it helping people? My research that I'm doing right now is all about how telehealth is effective as in-person therapy. And I'm figuring out if telehealth is effective enough, if people are liking it from a perspective of mental health professionals, as well as clients. For my clients specifically, I actually experienced going through Maslow's hierarchy of needs. Like, when I was figuring out how to talk about self-actualization strategies, I had a deep dive into how to provide them food right now, how to give them water, how they're surviving, how to give them toilet papers. I mean, that was a big one in the United States. How to talk about these basic needs. And from being a mental health professional, I turned all my skills to being a case manager at that time, how to give them resources to manage their lives before even thinking about how to talk about creativity, So I think that's what I saw as a mental health professional. And I'm still seeing it is still out there. We are still not practicing in person. I think we have given a choice to clients, not to us, to clients, if they want to come in person or not. It's their choice, because it's not just about pandemic. It's not just about COVID right now. It's about violence. It's about, I work in intercity Philadelphia, where there's a lot of violence going on. People are scared to even walk out of their house. So it's important to talk about those issues too. So what us as an organization, with the help of policymakers, with the help of presidential area and insurances, we have given choices to our clients to either, they can do their therapy through online, like Zoom, like DocsMe, that's what I use, any online platforms, or to be able to talk over the phone, because as we know, internet is not always available. It's not a great friend of mine. I don't know if it's good for you. It's never a good friend of mine. Like, I always struggle with internet. So I give a choice to my clients to talk over the phone if they want to, or come in person if they want to. So it depends on the client rather than me. And we respect their wishes, their needs, what they want. And if they are not willing to talk over the phone or do anything, we have other options. We can give them more clinicians. We have 50 mental health therapists at our agency, so they can shop. They can figure out what works best for them. In terms of in-person therapy, I personally noticed that with online therapy, I was able to understand more about how people are living in their homes, rather than what they're trying to put out there only to the environment or to the community. It was more interactive, as well as more interpersonal than in-person therapy. For example, one of my clients was showing her teddy bear to me, and she was like, "Oh, this is the teddy bear I really sleep with. I really wanted to show it to you. I can't live without this because I cannot sleep without this." So I felt touched that I was able to see that vulnerable part of my client that I couldn't see in person. So there are pros and cons for both. The difficulty that I faced was with children. children are, it's really difficult for them to sit in front of screen and not play in therapy. I mean, play is such an important part in therapy. So I introduced Virtual Sanctuary, which is a great resource out there if any mental health professional wants to look at it. It's a virtual sanctuary where you can ask clients to put stickers out there, and you can do art therapy online by sharing your screen. You don't have to be there for that. But I experienced that. And when I was presenting, so I started doing my workshops in India in like schools, where during second wave of pandemic, because I realized it was so stressful for them, and just to label what's going on for them, we started talking to children and telling them what to do, what not to do. Don't go out, don't touch this, wash your hands. But we ended up skipping on a part which is really important, that is telling them what COVID is. Why are we telling them to do this? What is the importance of that? And how we can give them like resources to manage the stress that is coming along with that. I think even before children knew what grief or what loss is, they started losing people around themselves. Like they started losing their friends, their colleagues, their parents, and they suffered a lot of losses. So that's why I published a book that was about how to manage stress during COVID. It is children's book. It talks about what COVID is, as well as how to manage stress during the pandemic. And now I realize that it is like it can be used even after pandemic, even after you're not in that sympathetic nervous system action, you are implementing your parasympathetic nervous system now and trying to understand what's going on. I also noticed there was extreme anxiety, as I said, heightened sympathetic nervous system, where people were reacting to everything. They were feeling whatever is out there is imminent danger to them, and they still are feeling that. I think it's really important to activate or to learn about parasympathetic nervous system by using grounding techniques, by understanding not everything out there is to your imminent danger, by evaluating the trigger, and helping children to do that. So I've seen increase in anxiety in the United States, like anything, and specifically in children. And they don't, like us, we can talk about it. We can tell each other what we are feeling, how we are feeling. We're feeling worried. We're restless. Children don't have that language. They don't know sometimes what they are feeling inside of them, what they are thinking. Is that right? Is that wrong? They start to evaluate themselves quite more often without even having the language to talk about it. So I think with my next book, which is, let me show it to you, which is Sam and Coco. It is also available in Spanish, by the way. Is where I have helped people or children to understand how to externalize anxiety, how to evaluate, how to understand what's going on, and then how to manage. We cannot, sometimes it's difficult to reduce it or just put it out there. It is important to accept it. So in this book, I have helped children understand anxiety, externalizing it, as well as how to manage it and accept it. It's really important to accept something before you even try to manage that thing. So in person, sorry, going back to your question, I felt like I'm rambling. Going back to your question, it is important for a client to decide what they want, because there are different resources out there. If they want to, like, I respect my clients' needs and go forward with that. So I think it's important to ask them, what do you want? What do you feel better with? Do you think this is working out? If not, we can move out of this and go to in-person, whatever works best for you. All my clients are online still. They don't want to come in. They don't feel safe enough right now, but the option is still out there. And that's what we want to do as mental health professionals, like in any other country, giving them the option giving them the power back. They lost almost like they really lost control. And the essence of PTSD, as our speakers mentioned, is losing control. So it's our responsibility to give them the power back, give them the control, and then see what happens. So I think that's really necessary in any field. I rest my case now.
Those were some actually very unique points, especially from that developmental perspective. Thank you so much for that. Working with the children especially be very difficult during these times. Especially since they do not really understand what is truly going on, and they require a more interactive approach, which could be very much limited online. So thank you for that incredible perspective, that unique experience. Now also that also reaches out to a very community-based level when trying to give them back the power over their own mental health in order to manage any possible disorders that may appear. Thank you so much for those unique points. And I hope to read some of your books one day. I'm sure I have a lot to learn there. Now, we will try to get to address the questions from the audience. We have one from Mankirat. She says that her question is knowing all about mental health and still getting to know it. She wants to ask if she wants to become a clinical psychologist as just a beginner. She wants to ask how she can go further to achieve her goal. She's still in class 11. That's an open question for any of our psychologist professionals here. Yes, Dave.
The first thing I would advise anybody that wants to get into the world of mental health is undertake your own therapeutic journey. Understand yourself first, build your own self-awareness, understand all of the things that you don't like about yourself. Find them. They will be hidden in your mind. If you don't find them, you will qualify without a problem. And then you will see a client who reminds you of those things that you don't like, and it will trigger you, and you will bleed into that relationship, whether you want to or not. By being self-aware, you will become the strongest, the most resilient version of yourself. That means when you have all of the theoretical learning, you have the practical experience, and you have that awareness wrapped around everything, your client will come away with the strongest, most positive therapeutic experience and relationship that they can have.
Thank you. Is there anyone else who wants to tackle that question? All right. So we'll see if we can find another question in the chat function. There is a lot of conversation in there. There are quite a lot of compliments to your input, Dave.
Well, thank you very much. I can only offer my thoughts.
I do not seem to see any other questions.
Zach, if I may pose a question to the remaining members of the panel.
Yes.
What are your hopes for 2022 in the world of mental health?
Can you repeat that?
Okay, so what are the professionals' hopes for the growth of mental health in 2022?
Dr. Lowe, would you like to address that?
Okay. I think there's a hands up as well, Omer. Maybe he wants to give an answer to this as well. But I think as I put it in my opening presentation, I talked about I really hope that in 2022 we see absolute reforms in education, especially in my part of the world, because historically, before the pandemic, mental health is like a taboo, right? So definitely I want to see mental health or psychological health in the textbooks, in everyday lives, as what Dave and the rest of the speakers are saying. We want to really teach these skill sets, for or the next generation, to be able good listeners, and so that everyone will be psychological resilient, and we don't need a pandemic, to remind us.
No, brilliant.
Now, if nobody would like to address that last question, we'll move it to concluding remarks.
I think I see Omer's hands up. You want to give the stage to him?
I asked him if he has a question, but he hasn't responded. Omar, if you have a question, please pose it in the chat function.
Okay, thank you.
All right. So right now, we shall. All right. Just waiting on Omar. All right. Thank you all for joining us today. Unfortunately, Honorable Hosna and Jalil from Afghanistan could not join us today. Hopefully, we can get her for an upcoming event soon. And please keep posted on our social media. We are consistently posting new content as well as new events on a monthly basis. Now we have a couple of questions. We only have a few minutes left, so let's dedicate just a few minutes to these two questions. Omar asks, how can you dealt burnout during COVID-19? And Vijay asks, does mental health awareness should be added in school education system?
Okay, burnout, effective time management and structured phasing of activity, and not allowing one activity or one time slot to bleed into another. Be very, very disciplined. I'm spending maximum 90 minutes on this, and then it will stop. And I will only work for 90 minutes on this. I will do something else. I might come back to that function at a later point in the same day, but I'm only going to do 90 minutes at a time. And it will allow you to put breaks in, etc. But be very disciplined about that. Mental health awareness in school education, exactly what has been said throughout the session is what is needed. My advice to anyone looking for an educational framework is to check out what APA has put together on our framework for positive mental health, because if we are going to go down the road that is currently being spoken about, where mental health becomes a set lesson, then we are going to do a disservice to everybody, professionals and young people alike. We have to weave the awareness into interactions, not have a situation where something can happen on a Monday morning and the mental health lesson is on a Friday. And the system goes, well, you can deal with that when you have your lesson at the end of the week. Right now, we're going to do it the old way in our class. That is going to be counterproductive, and it is going to mean that those lessons become a stark fail. We have to weave it in to interactions as they happen and build the understanding and the awareness within the professionals within the education system so it bleeds through.
Perfect, absolutely. Putting it into our education system really does spread awareness for the future. Anyone else?
I think it's also, I think very well said, Dave. And it's really important to build your toolbox. You know, you should have that toolbox with you, which you can open and use any skills you want when something happens. It's not, as Dave said, it's not vital to go and seek mental health therapy only when you're going through a situation. It's vital to develop and have a toolbox with all those skills that you can open up to be your own therapist. That's what we learn. We need to what we want to do is to be our own therapist. So that's how we can do it. We like, I studied in India, so we used to have all the classes, math class, science class, English class, whatnot. We learned everything. I think it's important to now put a mental health class to learn about anxiety, to learn about low moods, to learn about coping skills. I think it's vital to do that. How I personally dealt with burnout during COVID, it was standing up from my chair, doing some moves, even making funny moves, and getting back down after dealing with any client I had. You know, it affects our mental health too, because it gives us all vicarious trauma. So we need to get up from a chair, move, go out, drink some water, come back and sit. I think those breaks, as Dave mentioned, is so important and so vital to deal with the burnout or any stress that you're going through. So that's my take on that.
Absolutely. I'm going to take a walk around immediately after this. Thank you for that advice. Now we are coming, unless Dr. Adrian Lowe has any concluding remarks, we'll go to the end.
I think the concluding remarks for me is based on what the speakers has mentioned. They are all really valid, practical points, and I think it's about preventive measures as well. Yeah, so curative and preventive. And I think for the COVID, even though most of us may be like working from home, I think it's just complicates things even more, right? You'll be like being co-mixed with, work and the family affairs. So I think we really need to, set our boundaries right, having clear boundaries with whether it's familial affairs or with corporate affairs. We really need to learn how to set them, knowing how and set up to say no to things, not to be a yes man to everything, and that is definitely a precursor to burnouts.
Absolutely, it's really important to look at that situation and lifestyle in the whole round. Thank you so much, Dr. Adrian Lowe. Mr. Mushonga. Mr. Mushonga? All right. I'm not sure if he's still connected with us, but for our end of year event, we are very excited to say that we're going to do something quite unique. Ms. Mushonga?
Yes. I just want to respond to the previous question that, like, maybe on the issue of mental health being included in the education system, and I just want to repeat a short point that when it comes to mental health, it all starts from the family unit, and then we progress from there. And then again, a point that has been repeated again and again, that there is nothing to be ashamed of when it comes to mental health. We all have things that we deal with that we're not capable of dealing with individually, and we should not be afraid to approaching professionals, be it or even taking and approaching an elder or whoever it is that can give us a good enough advice so that we can deal with whatever problem that we have. It is not an embarrassment. It is just something that everyone experiences. It's like diabetes. Everything has got a cure, a prevention method, whatever it might be, that we all need to try and tackle together so that we can achieve the best future for individuals, communities, the nation. So thank you.
Thank you so much, Dr. Mushonga, for joining us and for your input. Now, today we're going to do something very, very unique for our end of year event to celebrate the end of year. So if anyone in our audience would like to switch on their cameras, if you would not want to, that is fine. It is up to you. If you'd like to switch on your cameras, you can now, and we can have a final snapshot to finish the year on with that to celebrate with. That would be absolutely wonderful. If you would like to switch on your cameras, you can do so now, and Tanvi will help us take that screenshot with everyone. Thank you so much to all of our speakers who joined us today. Thank you so much for all the input and the questions from our audience. I think we had a very, very fruitful discussion covering many, many layers of issues relating to psychology and mental health that existed this year and throughout these troubling times. Special thank you to Dr. Naveed Kapoor, founder, manager and head of the Peaceful Mind Foundation, for him hosting this organization, for him hosting this event. Thank you so much to Tanvi for all the technical assistance. Thank you for the audience for coming. Please be posted. We do events every single month. So we always post it on our Eventbrite page. So do follow the Peaceful Mind Foundation on Eventbrite. I also posted our Facebook link in the chat function. So follow us on our social media to keep posted on recent upcoming events and programs. We do a lot of different programs, training, and so on. Now, Dave Sleet from the APA is hosting an event tomorrow. So do check out the APA website for more information on that. Thank you everyone for joining us today. If you do have any questions or concerns, feel free to email us. Email back the same email you received the link in, or leave a comment on our Facebook Live if you're watching us through there, and with your question or concern, or message us on Facebook if you have any suggestions, concerns, or questions. Thank you all for joining us today, and I hope I get to see you in another event one day. Thank you all, and goodbye.
Thank you, everyone. Happy New Year.
Happy holidays, everyone. Happy New Year.